Good morning, and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. So today we're going to be examining data around social determinants of health. And although most of us are probably familiar with the concept, let's lay the foundation for some clarity. So here's one definition of social determinants of health from the CDC. So they are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. So it's important to remember that those forces and systems that the definition is referring to, it includes things like economic policies and development agendas, social norms, social policies, and political systems. And we know that social determinants of health strongly affect health outcomes. And this influence can lead to health inequities, which are unfair and avoidable differences in health status observed between communities. So the Healthy People Framework was created by the Department of Health and Human Services in the 70s, and it sets data-driven objectives to improve health and well-being of the nation every decade. And recently they added a new topic, which is social determinants of health. So to help people understand what types of things are considered social determinants of health, they've organized it into 5 domains, and we have been following that framework. So the first domain is economic stability, and then there's education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Let's look a little more closely at those domains. So the first is economic stability, and this focuses on things like housing and paying for food and employment. So policies that help people pay for essentials can improve health outcomes. Education access and quality includes things like well-performing schools and affordable colleges. And we know that interventions to help children and adolescents do well in school and to help families pay for college can have long-term health benefits. Healthcare access and quality would be things like having health insurance or a primary care provider. Increasing access to healthcare professionals and improving communication can help more people get the care that they need. Neighborhood and built environment means things like safety from violence or environmental hazards, access to opportunities to walk and bike in your community. We've seen that interventions like adding sidewalks and bike lanes can increase safety and improve health and quality of life. Last, we have the social and community context, and this examines things like people's relationships and interactions with their family, friends, coworkers, and community members. Things like discrimination and violence can have a negative impact on health and safety throughout life. So given that that is our framework for social determinants of health, where can we find data on social determinants of health for Hawaii? Well, one option, of course, is the Hawaii Health Data Warehouse, or HHDW. We've been around for almost 25 years helping to manage and disseminate public health data for the state. So part of our purpose is to gather, organize, and present health data to the public in a user-friendly format. And we do this using 2 websites. So we have hhdw.org and hawaiihealthmatters.org. There's a little summary of each site. I'm going to talk briefly about each one because we will look at social determinants of health data on both sites. We're going to start with Hawaii Health Matters, or HHM. So this is a user-friendly site with data for over 800 health indicators from dozens of different data sources. The indicators can be presented in trackers and shareable dashboards, and the platform also houses a resource library that's linked to the health indicators, so the data is presented with a bit more context. So this is a great site for people who want more than just the numbers. And there's a lot of data around social determinants of health in HHM. Today, I'll be showing you the Socio-Needs Index Suite, which is composed of 3 different indices: mental health, health equity, and food insecurity. We'll look at another great resource for social determinants of health data in HHM, which is the Socioeconomic Status Tracker. And then we'll also do some keyword searches just to get an idea of the data available on the site. Just a little background on the Socio-Needs Index Suite, and we have actually done a coffee break on this before, so if you'd like more details, check out our YouTube channel. But this is a tool set that integrates powerful analytics to help identify under-resourced communities. As I mentioned, it contains 3 different indices. The Socio Needs Index Suite is created and maintained by the research team of our website host, Conduent Healthy Communities Institute. Unlike traditional population-based data, which comes from the census, they use Claritas data, which is a large, continuously collected database used for marketing. Claritas provides more up-to-date, detailed, and granular population data. So what they've done is they've used a variety of health and socioeconomic indicators to create a composite score from 0 to 100, low to high, based on the value of these indicators. So these scores are calculated for the different geographies across the nation by county, zip code, and census tract, and then ranked from 1 to 5, low to high, according to their index value. And we'll take a look at what those look like during the demo. I also mentioned the additional resources around social determinants of health in Hawaii Health Matters. So we'll look at the socioeconomic status tracker and do some keyword searches. After we've explored those features on HHM, we're going to switch over to our second website, hhdw.org. So HHDW offers several ways to explore valuable public health data. You can search the data by health topic area or look at multiple indicators of health for a given community. And one highlight is an interactive data query tool that allows you to build your own report from one of the 6 data sources in the warehouse. So I will talk about, let's look at the different data sources and what kind of data around social determinants of health are collected. So the first one, and probably going to be the most robust one for social determinants of health, is the Behavioral Risk Factor Surveillance System. So they collect a lot of information that includes things like employment and income, healthcare, even internet access. And beginning with the 2023 data that we uploaded into the site, we built a new category called Social Determinants of Health. So we're very excited about that. Right now, it only has 2 indicators, but we are working with the 2024 data, and we plan to build several new ones to add to that category. So keep your eyes open. Another data source in HHDW is the Pregnancy Risk Assessment Monitoring System, or PRAMS. And that system includes data related to social determinants of health, such as income, education, social support, prenatal care. Youth Risk Behavior Survey is another data source available in HHDW, and as far as social determinants of health, it collects data around academic performance and plans, healthcare, food security, crime, housing, social support, and bullying. With the vital statistics, the birth and death certificates, we are a little bit more limited, but we do have some data on access to prenatal care in the birth certificates and to education in the death certificates. Okay, we're going to jump on the demo in a minute. I just want to go over some of the basics for Hawaii Health Matters for people who aren't familiar with it. So as I mentioned, this is a really great site for people who might not love numbers, maybe need a little bit more context around them. So this site uses comparison data and icons that incorporate colors and symbols to help users interpret the point estimate. So in general, red is bad, green is good, and blue is neutral. When you see a solid box with an arrow, that tells you there's a statistically significant trend. When the box is white, it's a trend, but it hasn't quite reached statistical significance. And you'll also see these green checks and red X's, and those mark for indicators that have target values. It shows you the ones where we have met that target value and ones where we still need a little work. You may also see gauges that compare Hawaii data to US states or counties. So real quickly, we'll just walk through this example. We can see that in Hawaii from 2019 to 2023, 12.5% of children live below the poverty level. The gauge shows us that we're in the better half of the values for the state. We're actually lower than the US value of 16.3, which is good, so it's green. And this is a statistical trend downward, which is also good. For the older population below the poverty, we are still in the better half of the states and better than the US value, but we are seeing a statistical trend upward, which is bad. So it's red. There are a few more symbols here. You can see places where you can filter, the orange boxes. The blue triangles are places where you can change place, time, or indicator. You can modify graphs and charts using that 3-bar icon. And in a lot of the data tables, you can sort. Let's go ahead and take a look at our sites. So this is Hawaii Health Matters. You can see our rotating banner here that tells you about new data releases. You can also register for our coffee break. But the first thing I wanted to show you was the Socio Needs Index Suite. So when you click on Find Data here, you can actually see it in the dropdown here if you want, or if you click on that, it'll open this page and you can see the 3 different indices here. So I was going to look at the Health Equity Index. So you can see here, this describes a little bit about how it was made. And if you want more details, including like which indicators they use in their algorithm, you can click here on learning more about the Health Equity Index. But what you'll see here is a map that shows all the zip codes in the state, and they're ranked 1 to 5 based on their level of need for health equity. So we can very quickly see those dark blue areas are the ones that have the highest need. And in addition to this map, there's also a chart that ranks all the zip codes from low to high. And then we also have a data table. And here too, there's one of those blue carrots, you can do some sorting. And just for example, if you wanted to have a closer look, so let's, for example, look at the zip code with the least health equity needs. So when you click on it, it shows it to you on the map and you can zoom out and see where it is. And we can see this is Aina area. So they're part of a lower health equity need. But the data is also available at the census tract level. So this is a great tool just to identify communities that need the most help. And again, there's a mental health one and a food insecurity one. Okay, the other thing I wanted to show you was our socioeconomic status tracker. So we have several data trackers, 9 in fact, on Hawaii Health Matters. These are great if you're interested in one of these topic areas. But one of them is this socioeconomic status tracker. So let's take a look at that. This gives you a little description of the tracker itself. Here again is where I said you can change things like a place or time. So here you can actually pick a geographic location and it will filter the tracker to show you data specific for that location. There's also a colorblind mode in case that's needed. It basically turns on these little thumbs up and thumbs down. But then we get into the data. So we can see here several measures of socioeconomic status, income, education, employment. There's indicators for poverty, neighborhood and housing, access to health services, access to resources for healthy living, and populations with special needs. So let's take a look at one of these. We'll look at the homeless rate. And what you can see here, this is what you'll see anytime you hit choose an indicator on HHM. You'll get, again, another option to select a specific geography. You can also look at older data here if you wanted to. It gives you the definition. So this is the rate of sheltered and unsheltered homeless people per 10,000 population. And then a little bit of the public health importance, and then we get into the data. So we can see that the source for this data is the Hawaii State Department of Human Services. This is from 2023, and we can see that 43.2 people per 10,000 population were sheltered or unsheltered homeless. And then we have this contextual information to give us a little idea of what that means. So we can see here that it's considerably higher than the US value, which is not news for anyone who lives here. It has increased since the prior value, but actually it's trending down, not statistically significantly, but the trend is going down. So, and that you can see below the data and these contextual values is the trend data. And then depending on the data source, a lot of our indicators will also have breakout data so they can show the indicator by, say, by sex or race, ethnicity, income. This particular data source, we only get just straight values for the state. So below this information is where you can see the geographies that are available. So on HHM, most all of the indicators are available at the state and county level, but some, like we looked at with the Health Equity Index, we can get data even down to the census tract level. So this is what it looks like when you're looking at the counties. It looks at our 4 major counties, ranks them and places them on a map, and again, a data table. And these data tables can be exported if you want to use the data for your own needs. Below that is information about the data source, and then we get into the related content. So this all comes from our resource library, and you can see here there's a lot of related content to homelessness. So this is a great place to look if you need additional information on your topic of interest. Okay, let me just show you quickly what this looks like if we use the search bar and search for simply social determinants of health. We come up with 142 results. So you can really see there's a lot of information in this site about social determinants of health. So really, the best bet, I think, is to use that keyword tracker and put in maybe not social determinants of health because you're going to get a lot, but whatever you're more specifically interested in, whether it be employment or housing, social support, those kinds of things. Okay, let's switch over to HHDW. So here is our homepage for HHDW. You can get to Hawaii Health Matters very quickly here. Once you're familiar with the site, you can go to building your own report right there. But let's take a look. I said BRFSS, the Behavioral Risk Factor Surveillance System, is really going to provide us with the most data on social determinants of health of these data sets that we have available. So if you go to data sources and click BRFSS, you'll come to this data, the landing page. So here we have some information about the survey. This is very helpful information including links to the surveys themselves, so you can actually see what question is being asked. But in this case, we want to look at the data. So we are going to build a custom BRFSS report. This is our health indicator selection page, and I'll just want to point out that we have some really good resources here to help you understand what's available and navigate through it, because we do have a lot of BRFS data on the site. So to help you get a better idea of what's available and find what you're looking for, there are some good resources. So here are the different topics for this data source. And I mentioned that we have a social determinants of health category. So let's take a look at that. Right now, as I mentioned, we only have 2 indicators available, but there will be more coming. Let's take a look at lack of reliable transportation. And if you hover over this question mark here, it'll actually give you the wording of the question, so you can see exactly what they were asked. So this was reliable transportation in regard to medical appointments, meeting, work, getting things for daily living. So let's take a look at the data. You'll see right away there are 2 rates, and I'm not going to, there's a little information about the 2 different types of rates here, but I'm just going to say in general, if you're just looking at Hawaii and you're not planning on comparing it, the crude rate is fine. So let's take a look at this crude rate. So you'll see here, this is our default report on HHDW. It usually gives you the 3 most recent years of data, but this question has only been asked for 2 years. So there's a whole new module in the Behavioral Risk Factor Surveillance System around social determinants of health. And once we have 2 years of data, we can create indicators for it. So this is one that was asked in 2022 and 2023. You can see the estimates for each year. You can hover over the bars to get the data values. And there's also a data chart. So this gives you your estimate, your 95% confidence interval. This is the estimated number of adults who replied yes to this, and the average annual estimated population. And again, yes, you can export this to Excel if you need. Down here, there's also additional technical notes, so including a suggested citation if you wanted to use any of these data. I want to show you one modification. So for those of you who have used this site, you know it's got this pretty powerful interactive tool. And this looks intimidating, but it's not. These 7 steps, you don't actually have to do anything. They are filters that are available for you to hone in on whatever group of the population you're interested in looking at. Let's keep everybody in the population. And so now we're just going to tell the system how we want to display the data. So this is a good one. Let's look at it by race ethnicity. So now what we're seeing is lack of reliable transportation in the past 12 months by race ethnicity. And this is one of the situations where when you see these 3 little dots, it means that you can do some sorting. So I like to sort, especially when I'm looking at something like race ethnicity. And then this can then make it easier to see the results. And then again, you have your data table here. And for those of you who know the system, you can actually go further and look at this by another dimension at the same time. So you could look at race, ethnicity, and sex. But I just want to show you some of the other categories. So, for example, we have demographics, which of course has a lot of different social determinants of health. We have our access to healthcare, which is insurance access. We have food security and screening and preventive services. So we have a lot of data around social determinants of health on this site. And as I mentioned before, there's also some in PRAMS, which is the pregnancy survey, and URBIS, the youth survey, and a little bit in birth and death. So that's just an example of some of the data that's available. Let's go ahead and switch back to the slideshow. Okay, I'm going to give you a time for some hands-on work. So take a few minutes and explore HHM and HHDW to answer the following questions. Okay, let's take a look at this activity. So the first question says, using the Food Insecurity Index, identify the zip code with the greatest need. So let's take a look. This is going to be on our, so we're going to again go to find data, and this is where we'll see our health equity indexes. So this was asking about the food security index. And it's asking for the zip code with the greatest need. So what we can do is just use this chart and go to the very highest one. And the answer is 96778. And if we click on that, it'll then zoom in and show, because I don't know the zip codes. So I need to see it on a map. And now I can see that it's on the Big Island. It looks like the Pahua area. So that was the first question. The second question says, use the socioeconomic status tracker to create a dashboard for the census place Kihei. So let's go back to our socioeconomic status tracker. I mentioned that you can filter by locations here. So in this place, Kihei is a census place. So we'll limit it to that. And now we're going to see the data for Kihei specifically. So the question asks, what percentage of adults age 25 plus in Kihei have a high school diploma or higher? And we can see that is right here. So the answer is 94.4%. And then it asks, how does that compare to Maui County? You can see that when we filter for a smaller geography, it will now start showing us not only the state value in comparison, but also the county value. So we can see here that Kihei is higher than the overall value for Maui County. Okay, and then the last question says, looking at the social determinants of health category for the BRFIS data in HHDW, which DOH race ethnicity has the highest rate of housing insecurity? So that's this other indicator. And we'll go ahead and take a look at it. Again, this is our default report, which shows it to us by year. But if we modify the query and we tell it that we want to see the data by DOH race ethnicity, now we can look and see, again, here we might want to do some sorting just to see. So we can see that the race ethnicity with the highest rate of housing insecurity is other Pacific Islanders at 24.2. And if you're curious what housing insecurity means, just take a look at the question and you can see how it's being defined. So in the past 12 months, was there a time you were not able to pay your mortgage, rent, or utility bills? Wonderful. Okay, let me put the answers up here. And again, thank you for joining us today. If you have any questions, please don't hesitate to email. And I appreciate you joining. Thank you. I do want to invite you to join us in January. Our next coffee break will be on January 6th. And we're going to showcase some new updates to the Hawaii Health Matters site and also review the resource library there. So join us and see the new layout for our indicator detail page and explore some of the resources in the resource library.